You're right, Linda. Hazel's just getting her audio on.
Hi.
You're right, Anna. Is that you on that photo, Anna?
Yes, it's me.
Love your boot. So we've got a couple of minutes. There's I've only heard from Sue who can't make it. Although some I haven't heard from at all. So hopefully they have got the message in the WhatsApp group, and then I sent an email out. So hopefully they've all got it. If not, it's been recorded and they can grab it after. So that's great. So we've just got a couple of hours, and I'll give it a minute. Have you all got a drink or something? You're okay? Hazel's
Yes.
audio still kicking in. And I think, depending on how many we've got, if it is just the four of us, we can just all unmute, I think. If it becomes, how many of us is there? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 of us, we might need to do a mute and then a hands up. But if there's only a few, it's not too bad. Just when there's loads and everyone tries to speak. So I've literally just been eating a cream egg and drinking some, it's not alcoholic, Linda, no.
My book, Rachel.
Have you been watching Linda, Rachel?
Yeah, I know, watching the WhatsApp group.
Linda, you know I love you, but it's like, yeah.
What's that about?
Oh, brilliant. We've got Chris as well. Fantastic. Check you in. Chris, Linda, Hazel, Anna. Brilliant. So we're just going to do this. We'll just give it a couple more minutes. And it's a very loose schedule. The only reason I put a schedule on it is to give you some insight into, the point of this, really. So catch up, a bit of an overview and an update, Q&A, practical review if anybody wants it, what's next, which for you guys is the practical exam, and then some documents that I'll send through if you haven't found them yet. I know that Hazel's been struggling to get onto the portal, so if that's the same for the rest of you, I'm not sure why, although we are doing some updates at the minute, Hazel, so I don't know if that's interfered with something. So I am working on it with the web guys, so my apologies, which is why I sent you the links man through. So if there's anything you really need and you want to get access to and you can't, just email me, because I can just send you a PDF or a copy or something. So hopefully one of those or a few of those was helpful, Hazel, so that you can amend it and make it your own. They've all been made by other biomechanics coaches, so it was basically a links man, wasn't it? I think I sent you about 5 or 6 variations, although some were PDF and some weren't. Some put colour coding on, some have still got their logos on, so obviously you need to remove those. But they've all said, yeah, feel free to use them. But it's interesting when you said you want to put them in the right order. And I think everybody has their own right order, but it's not necessarily the same as each other, which is fine. So don't feel that you need to fit the order that it's designed in. If you want to do what Hazel's doing and kind of redesign the links, man, that's really not a problem at all. So I think let's try unmuting everyone. I think with there only being 5 of us, what I'll do is if I'll say your name and like we'll go to you. If you want to raise your hand if you want to speak, just to make it a little bit easier, rather than having to keep switching in and out. With there's only been the few of us, unless there's a load more of them coming. I'm not sure what's happened to the rest of them. As I say, there was only Sue said she couldn't make it, but we'll record it and send it on. So catch up, really. So Linda, how are you doing? Are you all right? Are you practicing?
Yeah, I'm doing good with I'm doing a lot of online stuff, but it's mainly with only 2 clients at the moment, and it is a lot around the pelvis. We are moving up to the shoulders. I haven't really done much with the feet and the knees. But as I'm working with the clients, it's because I haven't got to that point with them yet. Does that?
Yeah. common.
What I'm also doing is with my training, I'm using the like I'm doing the antispasms and I'm using it with mine so I understand it more. So it's really helping me.
Good.
And it's also helping with my stroke rehabilitation as well. I'm really finding it's really helping me.
Good.
So,
Good. Yeah, that's the point. And the lack of practice is not uncommon even without a lockdown. So
yeah.
if you weren't locked away, that's usually what people find is the pelvis. Yeah, I do that loads. I learned that first. Spine, similar. Shoulders, okay. Knees, and then feet.
Yeah, I'm kind of at the shoulders at the moment. So, but what I'll do sometimes is, so we've got to the shoulders with some of them, but if they find that their hips are getting tight, then I'll go back, do the 4 signs, and then is that correct to do that? So go back and then go back to where you sort of left off.
When you say go back, what do you mean go back?
So just so in a session, so say we've been doing the pelvis for sort of 6 weeks, but then and then we're just starting to move up onto the shoulder mobility, but they come in a session and say, oh, you know, my hip's been playing up a little bit. So what we'll do is we'll just go through the 4 signs, even though they're still doing those exercises as well regularly.
Yeah, if you think that's right, then yeah, absolutely.
But then get them to focus on the exercise, the next exercise where we've moved on. So they'll be on the shoulder. I'll be like, look, focus on this for this week, and then see what changes from there.
Yeah, if you remember, the main focus of what we're trying to achieve as a biomechanics coach is a maintenance program. This isn't going to be a one-stop fix, and I think you all know that. And we've got to try and do diplomatically is try and help a client understand, like squatting and running and eating well, it needs to be consistent. Same as I move freely. Chances are they're probably going to have to carry on doing some of the pelvic stuff, spine mobility, long term. It's going to be an ongoing thing rather than, right, you've done that, pelvis is fantastic, you don't need to do that anymore. It's more about getting to the point where they know when they need to do the core sign.
Yeah.
As an analyst, which is what we do, we're trying to see what changes, what is their real kind of gold dust, if you like, I move freely set of exercises. And you might, like I have in the past as well, take them through the whole program, the pelvis, the spine, the shoulders, the knees. The hip flexors had been fine at the beginning, but down the line, I'm like, oh, why is that happening? Why is that still happening? And I've literally gone back, just chucked in the hip flexor release. And that's been the thing that I missed right at the beginning. And I've taken them through the whole program. So it's just being aware of sometimes the very subtle nature of, which is why when people say it wasn't that bad, so I left it. I always say, you know, just keep it at the back of your mind, rather than like on my links, man, I don't think I'd even mark that the hip flexors were positive because they dropped really low, but there was about a 5-degree difference. And this is, I'm going back 10 years. But by the end of 8 months, when there was still a sticking point, she did the hip flexor release and literally thoracic spine, upper back pain, shoulders released. And it was like, but that was the least positive test in your pelvis. That's why I didn't give it. So it's just always kind of remember, always look back. And your job really is, as an analyst, to analyze that data and think, right, what have we tried? What worked? What's changed? Is there more that I could add in? So yeah, if you feel that's right, that's not a problem at all. But yeah, I hear you on the practice side. What about you, Chris? How are you getting on with your stuff? Are you able to practice? Have you done much?
I've been in lockdown since forever, it feels like.
You can tell by the length of guys' hair.
Yeah, I know, my beard. I'd be like Forrest Gump now. No, I mean, I've done as much as I can. Like I've been restricted with regards to how much actual physical sessions I can do. I got a fair bit done when I could. And the one thing I will say is I feel a lot more confident with my own workflow, if you'd call it that. Yeah. The one thing I definitely feel under practiced on though is feet.
Yeah. So
I feel all right with everything else. Obviously, I'm sure I've got plenty to work on, but like I've done far less of the feet. So I feel like that's my one area where I definitely need to do more.
And I think feet are probably the most hands-on you'll get. It's
Yeah.
very intricate. The anatomy of the foot is complex, all the joint surfaces, and it's the last thing you've learned.
Yeah.
And as I said to Linda, even without a lockdown, what you're saying is the same as I hear all the time, is people are least confident about the feet. So don't beat yourselves up, as long as you understand the tests.
Yeah, I mean, I understand the test. Like, the hardest thing for me is like I said, because like all of my clients who I previously were working with, I'm still working with them doing the online stuff, but I just don't feel like I can accurately do the feet stuff online. I know that
Have you tried the index, the foot posture index?
Yeah, I have, and I just don't feel like I'm going to be giving advice that I'm 100% confident in because I've my lack of experience.
Yeah.
I do understand you can do it.
Yeah, if you're still working through pelvis, spine, shoulders, don't worry about the feet anyway.
Yeah, exactly.
And the only thing you are going to do is inversion, eversion exercises. That's kind of it anyway.
What I've ended up doing is just adding some supination movements in anyway, because I just figure that it's not going to do any harm. But like, obviously, I'd like to get my hands on people's feet to actually practice. That's what I'm missing on.
Yeah, I totally hear you. So not uncommon. What about you, Hazel?
Okay, I'm unmuted now. Yeah, good. Same as everyone else, I think. Really need to get hands-on to be getting a bit more experience. But everything that I have been doing with my clients, so I'm sort of like layering things on, working with the pelvis and then incorporating other little bits, but not too much, not kind of taking it out of my my remit kind of thing, you know, just sticking with what is safe to work with. And the results that I have been getting with clients have been really positive, really good, more movement, function. So in that aspect, I'm happy with kind of that. But like everyone else is saying, I want to get hands on, I need to be a bit more comfortable and confident doing the feet, and all that kind of stuff, really.
Yeah, and I think you're going to get super busy when we start coming out of lockdown. I think there's going to be a huge demand if you're very, you know, studious about your business and marketing side now while we're in lockdown, and your vocabulary and your understanding of what you do as a biomechanics coach, and you start to market as we come out. I think you're going to find that there's a big demand for what we do in terms of understanding movement and assessment and how to improve that through exercise. I think there's going to be all sorts of problems coming through. So I definitely want to talk about the safety net. I'll talk about that later on. But Anna, how have you got on? Have you done much practice?
To be honest, for the first 2 weeks of the lockdown, to be honest, it hit me so bad that I was kind of feel like I won't drop everything and just run away. And I just mentally, I couldn't cope, to be honest. But gradually I went back, I put myself back on the feet and I'm like, come on, you can do this. And I stopped putting stress on myself about it, things, if you know what I mean. I like, you know, I try to do step by step. I went back to teach online on Zoom. To be honest, I'm getting more confident with my online clients, what I haven't done in the first lockdown, the second. Now I'm doing quite a lot of PT session online, and to be honest, I'm fine with this. I am using quite a lot of biomechanics stuff during my PT session to help them, because obviously there is like, it's different flooring. They got more spasm around them lower back and everything. Whatever we do, you can't correct them much, like, no, because sometimes the camera, how the angle of the camera is, you can see them properly, so it's a lot. I can share with you what I've done and you can pinch my idea. But you know, Rachel, when you said that during the assessment, we don't have to remember stuff. You don't expect us to memorize, okay? So I create myself a folder. When I did, by doing the Linkman, every single of the assessment, and I highlighted everything what I have to remember. For example, like when they have to sit down, when they have to have a face down, when they have to. And I found this very helpful. I've done a bit of practice, especially with my neighbor opposite door, because we're kind of in the social bubble, so she's right. And it's like, no. I had a quite interesting situation with my other client when we've done the first, before the lockdown, when we done the first test. For example, she was absolutely like, she was positive on her pelvis, but we didn't have any like sciatica nerve positive, like the leg raise positive or anything. After a few weeks, she started experiencing the lower back pain. It wasn't nothing to do with me, it was her pelvis injuries. But when she came back for my biomechanics test, her leg raise came up positive. So for me, it was lack of my confidence, and I didn't believe myself. But for me, I was believed that her performance, there was a problem with her performance, and there was something was happening there. And to be honest, she went back to the osteopath, and the osteopath, she confirmed that her performance was a problem. That's why, like, no. So she went back to Forsign, and also osteopath gave her some exercise. I didn't move her any further because at the moment we're waiting for her to recover from that, because that is quite a long recovery, and I don't want to interfere with anything else, especially when now I'm working with her clinician very close. So we stick to Forsign. She's doing the exercise. She's not worse, she's getting slowly better. But it was quite interesting experience for me that the first test was absolutely negative. We went through the pelvis, we were going back up to her spine, and then suddenly we reversed with everything and even got worse because of her leg raise positive. But how you, Rachel, said, sometimes you have to trust your gut, and I was right when I did the test, and I knew there is a problem with her performance. So I knew there was something going on, and it wasn't nothing to do with me. It was just, but you know, when you feel like, oh my God, have I give her something what make her worse? But actually it wasn't me. It was just her body, how react to other stuff what she was doing, especially hard flooring and jumping and not doing her Pilates. So we were putting everything together, and that kind of makes sense. So I just thought that I will share that with you all.
Yeah, no, and thank you for sharing. And I think it's really important. It would be a very rare, I mean, if at all, occasion where any of you would step outside of your duty of care and do something that actually made somebody worse. The only time that's going to happen is if they don't do what you've asked them to do, or they've not told you something, or they do something new that the body then has a response to. You're all conscientious practitioners, you all follow consultations, you all do due diligence, all of that stuff. So it's very rare. I mean, I've never really heard it. There's once where I had a client who came because of personal trainer was negligent, and I don't know if I told you, he dropped a plate on her back when she was doing a plank.
Yeah.
And hurt her back. She's actually come back to me just this week, actually. And that was like pure negligence on his part, and she went through a court case. But outside of that, when people have got worse, you question them further. They've either done an event that, like, climbed a mountain or ridden a bike for the first time in 30 years, but they've done something wrong, or there was something they didn't tell you. So
but this is exactly what happened when I start questioning. We start put things together. She was doing yoga twice a week before. She was doing her Pilates twice a week, and she stopped everything. She like get out of her routine, and on the top of it, she start doing, for example, high impact stuff on her lunch floor. So we get her a mat to take the high impact. I stopped her from doing any kind of classes. She only followed this, and actually came to the point that it's not worse, but I think so we're on the way to recover. But her osteopath, but that was just when I thought the first my thought is like, I can't be right, this must be something. And I was feeling like, oh my God, have I done this to her? But actually it wasn't me. It was her like changing her routine and what she was doing.
yeah, and a big part of what we do is educate them on the things that do make you feel different. So they may not even have realised that was the thing that contributed. So when you question them further, which again is a skill that we need to hone, is to do that carefully so that it's not like a finger pointing process. You're just questioning them. And actually a really good technique is to question them in a way that they realise, yeah, actually, do you know what? I've just realised it's probably my new shoes or whatever. So
Yes.
it's a good example, Anna. Thanks for sharing. Gordon, how are you getting on, mate? In the dark. Is it night time where you are?
Well, one of my lights have gone out in the ceiling. So I've got to climb up there and go and change it. And it happens to be not where my desk is, but over there, but it points this way. Never mind. And I've got to watch because my timing's been out today. I started baking some bread, and that's why I was 3 minutes late, because I had to get it in the oven. And then, of course, as I poured it into the tin, it went all skew with, and anyway.
Can't tell us that and not get any.
Yeah.
Are you okay? Have you been able to practice at all?
I've had 2 clients, but they didn't come through. They came through my Bowen therapy side.
Yeah.
One of them, I think we spoke briefly about last time. 68-year-old lady with very bad shoulders.
Yeah.
She sent me her scans and all the full doctor's notes and everything else. She's had the problem since 2016. Says she experiences quite a lot of pain in her shoulders. She couldn't move her arms. She could only get them sort of to that level.
Yeah.
Couldn't get them up. And when she was sort of standing, if I move a bit further back here, she was sort of leaning back, so her upper shoulders were back, sort of in the curve. I didn't do the lower leg, but I did all the upper body stuff that she could do. She couldn't get her hands onto her shoulders to do the rotations. So I said, just get your hands to wherever you can.
Yeah.
From there. Long story short, she can now get her arms up to there. She can rotate her hands. Before she couldn't rotate the hands. Her posture has improved. She's still doing 4 signs, static leg press. She's doing side bends. And what I do now is I do a weekly class with her where I go through the stuff with her online. And she actually likes that because she said she kind of gets sidetracked. Now she's committed to have to do it. So, and I charge her for it as well, so that's good. So, yeah, so that's working okay. Then I had another lady who saw, I sort of put my stuff out there. I don't know if you guys have got it. It's called Your Neighborhood or something, your neighbor, next door neighbor or something like that. It's basically like on your street. And I posted on there for my Bowen therapy and that kind of stuff. Basically just put my business card up. And a lady phoned me saying, oh, you do Bowen technique. My Bowen therapist has moved to Swindon and you're running in the next village. And I've had a back problem since the middle of December. Can you come and see me? So she came and saw me, went through all the history and everything else. Apparently it's a recurring thing that happens once a year. I don't know what she does once a year that causes it, but anyway. She couldn't pinpoint anything in particular that actually caused the lower back pain. So again, went through the screens, just having difficulty to sort of stand and walk. So I didn't do the legs. Went through the screens that I could do. I didn't do any of the shoulder rotations, anything like that. And she was positive in a number of areas. And again, she's now doing 4 sign and also the static leg press. So I saw her 2 weeks ago. I'm waiting to have a session with her again just to see how she's progressed. I did send her an email after how it's getting on. And she said, well, she walked out of the clinic with no back pain, so that was good. She said, oh, it's brilliant, she can actually walk again. Yeah, and she's 63, so yeah. So some success, just wish I could get more clients, but in this climate, it's difficult, you know.
Yeah, I think, and I think it is the ability to adapt as you're all kind of like acknowledging we're restricted. Sometimes you're restricted even without a lockdown. Like in Gordon's case, you know, you have somebody who, even if you are face to face, there are some things you can't do. The system is designed and it is supposed to give you a baseline, and then your expertise and skill comes in the way you apply it and use it with each individual client. Yes, great if you can take them through pelvis, spine, shoulder, knees, feet, and you can do that in a swift and organised manner, fantastic. But as you've all kind of acknowledged, there's a variety of things playing in here. Anna's example of her lady, you know, going backwards for a variety of reasons. So it is, the skill is about using it in whatever fashion you can to help your business rather than feeling restricted by it. And I think that's a key component when, particularly at this point, is a lot of people feel almost like, oh, I haven't been able, I've got to do the pelvis first. If you, for any reason, feel like Gordon's just given the example, you cannot do it in that order for the best care for that client, then you can't do it in that order. We're not we're not saying you have to start with the pelvis or you can't do it. It's about using the system to your best knowledge and understanding why the system's designed the way it is, so that you can manage the system to each client, which is a big factor to play in there. But the system does work if you can use it as near as you can to the way it was designed. Omar, have you managed to have much practice at all? Have you? No. Have you practiced on your fellow, on your hubby?
Yes. So I've done a couple of online sessions, which were okay. They were easier than I expected them to be honest. I done one before, as soon as we did pelvis, and it was okay. Then after the last meeting we had with the feet and everything else, I tried to do the full screening. It was easier than I thought, but it kind of worked. Hands-on approach, I've done it only at home, that was really good. And what I find is that I forget stuff very quickly. I think it's because I don't have the routine, I don't have enough experience, so I go in and I try to remember the tests, and how to apply them, how to do them, and then I need to remember what exercises to go with what, and I come out of the session that I've just done thinking, yeah, that was great, I know everything now, I'm a superstar. And then if I go back the day after, I'm like, what was that again? What do I do there? Is it on the top, on the bottom? So I just need the physical practice, I think. With regards with what was the hardest thing for me, feet as well. I'm not a big fan of feet anyway, but it was that kind of jiggling of the feet, looking at the feet, and I just find it was a bit tricky. But apart from that, I'm okay. I don't feel like I'm ready to take an assessment tomorrow. But I think that if I start applying myself a little bit more and practice, it will eventually come. What would be good is to have different people to practice on. Because even if I practice with my husband or every day, it's like the tests will be very similar from one day to another. I know, where the point of stretching are with the nerve tests. So it's just like, it becomes a bit stale. It's nice to practice with different people, I think, different bodies, different shapes, different abilities, to make sure you have the most possible experience and exposure, but it will come.
Yeah, and as an educator, you appreciate, Omar, I know the idea that it is about practice. So I think, number one, your exam ain't going to be happening next month, just for starters. I doubt we'll be face-to-face for anything until after March, April, Easter time. I think they're reviewing everything middle of next month. But I'm just thinking, and I'm supposed to start some new diplomas 20th of February. I really don't think they're going to be starting. So it's about what can we do in the meantime? Well, it gives you the advantage of time. And I think one of the limitations is how you practice the hands-on stuff, and that's something that can't be helped. So the more that you can sort of practice online like this, and maybe whether it's friends, clients, relatives, just literally practice what you can online, whether it's a paid client or your mate Bob down the road, who you just practice, because like Omar was saying then, one of the key components of where you go through a massive learning curve is when a client asks you a question and you're like, oh, how do I answer that? I don't know. It might be Anna's example of her lady coming back worse than she was before, you know, and she might come back and say, oh, that exercise you gave me made worse. How do we have, you know, strategies in place to be able to get ready to respond to those things? So I think where you might benefit is to, even if it's just relatives, it's a way of having something to talk about. I think one of the things I'm finding really hard right now with friends and relatives is, what do you talk about? The only thing we've got to talk about is bloody COVID, and it's the last thing I want to talk about. So if you can have the excuse of saying to your brother or your niece or whoever in the other end of the country, can I do an assessment practice on you? You can ask me anything you like, and you literally just take them through that process. Might be a way of being able to practice the visual stuff. So you can hone it then and have more confidence about actually selling that service online. So I know some of you are more confident with that than others. Some of you have practiced that more than others, and that's totally normal and fine, and it's okay. You know, like Anna was confessing to a bit of a, you know, brain block at one point, and that's okay too. Under the current climate, I think it's totally understandable. I like it, Gordon. That sometimes even the most mentally robust of us is going to have a real dip in motivation, and maybe for a period of time. Please I don't want any of you to feel any pressure from me beyond what you feel is good pressure. So number one, no pressure. I'm just trying to give you tactics to how to improve your confidence. Linda and Chris are obviously kind of like all over that stuff. Hayl's done quite a bit. Anna, Omar, Gordon, maybe, you know, just want to get a little bit more done. Anna's starting to get a bit more. And so you're all in similar places. And as I said earlier, feet is very commonly at this point, even with no COVID around, they would be saying the same thing. This is what I hear all the time. So please don't be too concerned. It's looking at other resources like Sam Chidwick, who's he's over in, I want to say Birmingham way-ish, and he's a very forward-thinking podiatrist. So we can always take advantage of other professionals if we feel a client needs a foot specialist and we're like, I really haven't got confidence with the feet yet. We could speak to somebody like that. So obviously in the biomechanics coaches, you know, not to underplay there. It's good to hear from all of you. I like it that you share your stuff in front of each other so you can see how we're all in different places. Fine, really not a problem. We're not going to be doing an exam in February. Maybe end of March, I'm not sure. I think we've got to wait until mid-February till I can start to maybe plot out a potential schedule. But then I'll be far and away and just getting stuff in as and when I can. But at the same time, there's no pressure for you to do your practical in March if I run one in March. So there's scheduled to be another one at the end of the year. I think it'll be November, December time. If you would rather just wait, fine, no problem at all. But what I will do is I will sort of proposition provisional dates and say, look, do you want to come to this? If there's 4 of you, brilliant. If there's 1 of you, I might ask you to nudge on to the end of something rather than hire the room for an entire day. If it's just 1 of you, if there's a handful of you, we'll run it. but I'm happy just as much to move any of you who want to a later date. And we can quite easily, I'm down in London quite a bit, hopefully, doing the diploma, so we can just nudge you onto the end of days. If it's just one of you or a couple of you, we can do things like that. So are there any specific questions? Hazel, you asked me a couple. I haven't got them in front of me. Can you remember what they were? Do you want me to have a look? I'm trying to remember where you sent them. Was it on WhatsApp? Can't remember where you sent them, Hazel. No, it will be on Messenger, wasn't it? Hazel, let's have a look. Where have you gone? Hazel, right. So, oh, it was foot, yeah. Mid-tarsal joint test and the arch height test. Is it something we can? Yeah, no problem at all. So if, oh, sorry, Linda, do you mind muting? It's all right, sound interfering a little bit. So if there's any of the tests, so this point now is to Q&A. So what I would suggest you do is if you have a specific question, like Hazel's, I've got yours, Hazel, by the way, can you type it in the chat box? And what I can then do is run through them. And if that involves, there's also, we can do practical stuff. So I can get my skelly out, I can do the foot, I can do the mid-tarsal test and the arch height. I can pull up the presentation and we can talk it through like we did on the workshop, if you want to do that again. But if you type any specific questions into the chat box so that we can then go through each of those. Yes, Chris, thanks for reminding me. Is that there was going to be a practical day prior to the exam practical. So I have got that on my radar. One of the things that could potentially happen is that, and again, this is going to depend on numbers, is that you could jump onto a section of the next diploma. So for example, if depending on how many learners I get, and it is actually looking quite busy, it maybe I have to do an extra day anyway. But it might be if there's like just one or two of you, I could just bump you into an extra foot day. But actually, I think where I was coming from with that extra day, I actually need to see, are you ready for a practical exam outside of just watching you on a workshop? It's about, right, okay, let's do a full screen. Let's have a look at you all in action, which is, I think, what you're talking about, isn't it, Chris? Is a full practice day, yeah. And then what we can do on that day is we can do feet, we can go over things, you can all do full practices, you can use your links man, Anna, you can use your little system and show everybody what you've done with that. I can show you how the exam will look and feel and guide you on all the cheat mechanisms like flashcards and all the little reminders that you can use. Because when you actually go through the process of what an exam feels like, you go, I actually need a highlighter pen like Anna's suggesting, or I need, like Omar's saying about, I need to know which exercise goes with which test. So you might have that in a list somewhere. And I may have resources for some of these, but it is about, you might have a different problem to anybody I've come across before, and you might think, actually, I need this resource, and it's something we haven't done. Create your own is fine. If you think there's something that's going to be useful for everyone, let me know. Yeah, and by the way, Chris, to that next point, any flow is fine by me. I have no problem. So Hazel wanted to put the screens into the correct order, which is Hazel's correct order. The order that they're in at the moment is that Biomechanics coach's correct order. So whether it is pelvis, spine, shoulder, knees, feet, or lying down, sitting, standing, or standing, lying, sitting, is fine. You can create your own. I don't want you to feel limited. Yes, Gordon. Gordon's taking the bread out the oven. I can only imagine what your house is smelling like, Gordon. There's nothing like the smell of fresh bread, is there? So yeah, finding your flow, like as Chris has said, and I think this is the kind of what is a challenge at the minute when you're only online, or you've only done a few face-to-face, or you've not yet done feet. Where do I start doing the feet? Do I mark the feet when I do leg length? Do I do them when they're sitting or lying? Do I do them standing first? You know, so that's really the bit that gives you the confidence in the exam. So I think, and I think we were talking about having a practice day and then 4 weeks later offering the actual practical exam day, wasn't it? That's what, that was the idea. That's not fixed. That was just a suggestion for those of you wanting to get the certificate quickly and move on, which is, I know there's some of you just want to get your diploma. It's all a bit fluid and, you know, dynamic at the minute, as you know. So, but yeah, thanks for that, Chris, reminding me on that one. Does anybody want to go through, there's no other questions come up. Did you want to go through any other stuff, any practical stuff? So mid-tarsal and arch height.
Yeah, just the feet would be good, just to have a, because we haven't been, maybe just to see a little bit of a feet test.
Yeah, I can't do it because I haven't got a body, so I'll get a foot. And then the idea would be 1 foot.
Feet in general, yeah. Let me get my...
And then relay your thoughts. So subtalar motion we'll do first. So what position would you be in for the subtalar motion test, or your client be in if you were going to do that one?
Lying down with the ankles on the edge.
Are they going to be on the back or the front?
On the front.
Yeah, lying down, face down this way. And the subtalar... Oh, sorry. I think is your daughter in there, Linda? Is it your? No, I just keep catching something, thinking somebody's speaking. The subtalar joint is obviously right inside the ankle joint, below the talus, which is the kind of bone in the middle there. Remember when we do the alignment test, we feel the talus heads. So the subtalar joint is underneath there, and it's predominantly where pronation and supination occur. This foot doesn't move very much, but they occur a little bit. There you go.
Is that where you wiggle?
So yes, exactly. So when we ask the client to lie on their front, and as Omar said, we want the ankle joint to be free deliberately to feel the movement. So because it's the subtalar motion test, it is a joint mobility test. And you've got 3 ways to score, and it's all subjective until you've felt a few feet, which is often why people find this one difficult, because you haven't had your hands on many feet. So when they're lying prone, we want to fix the leg, so we put the hand on the calf, and we we take the head of the little toe, or the ball of the 5th met, or 5th toe, the last toe. From there, we push that towards the middle of the knee, just for a standard way of doing it, and then we give it a wiggle. And the wiggle is to sense how mobile or not that subtalar joint is. And if we don't keep the leg fixed, then we can kind of feel more movement that's actually not from the subtalar joint, it's coming from higher. That's why we fix the leg. And the dorsiflexion is to just put tension through those plantar flexors so that we can really feel how much laxity there is through that specific joint. Now, remember, we do want some movement because that's where the motion occurs of pronation and supination. So we do want a bit of movement, but we don't want it to be flapping in the wind. If it feels like those surfaces are almost kind of doing this as you wiggle it, you're almost trying to visualize, as you wiggle that foot, a human body on top of that laxity. Is it so loose that you think they've got a propensity to pronate? Or are you doing it and you're thinking, well, that's not moving very much at all, and it's really stiff, it feels quite limited? Then it may be in the propensity for supination. So if it's very stiff, propensity for supination. It's very loose, propensity for pronation. Somewhere in the middle is the tricky bit until you've felt a few feet. If they're at the extreme end of loose or stiff, it's dead easy. That's flapping. That's like, you know, you can sense that one straight away, as long as you've got the dorsiflexion. Super stiff, not as common, but when you get a stiff subtalar joint, you'll know about it if you haven't already, because it's just like, it just doesn't go anywhere. It's when they're somewhere around the middle that we feel a little bit like, actually, I'm not sure. And that's purely practice, which I'm afraid you're just limited on at the minute. So as long as you do that visualization in your head when you're doing that test, imagine them walking on that joint. That's how I kind of compute how much risk does that hold. Because if it's very loose, it holds risk. And if it's super stiff, they're going to have some degree of limitation, even in pronation. They need some degree of pronation as well. So does that one make sense? Any, yes, it is being recorded as well. Any questions around that particular test? Okay, cool. So then the mid-tarsal test. So the mid-tarsal is even, I think, a harder one because we're talking about a whole set of joints. And I always think this one is the hardest one as a biomechanics coach to perform because you've got to get into position and then wiggle and move around. So that's why I think this one can be super challenging. So again, it's a mobility test where we get the client sitting or lying, can make it easier or harder for us and for them. We need them relaxed. I personally find if they're sitting with the legs straight and supported, I think that's the easier test. It's also easier for me because I can stand up and do it and move around in a kind of a wide squat position. Whereas if they sit and do it, I've got to try and get down here and move around. So if you're not very mobile yourself and they're sitting on a chair, I think this one can feel quite tricky. But if you can get, always remember the scoop of the hand goes in the scoop of the foot in terms of the twisting part, and the heel, get the calcaneus into the palm. So those are the two sort of landmarks, if you like, for getting hold of it. And then the tough bit about the mid-tarsal test is remembering the rear foot and the forefoot are going to be doing two completely different actions in different planes of motion. And that's what I think makes this one quite challenging. So what I do is I try and break them down. And even if I'm with a client, I will always do it like this. I will always start with the heel. And what I'll do with the heel is I'll just do inversion, eversion, yeah, which, again, I'm not going to be able to show you on him, is where I do my chicken arm. Yeah, so when you turn the foot in to inversion, what's that? Is that pronation or supination when it's turned in?
Supination.
Yeah, good. Well done, Omar. And then when you turn it out, that would be a pronated position on the whole foot as a whole. So when the heel turns in or under, inside, that's a supinated position, or that's where supination occurs. When it's everted or the base of the foot is turned out externally, that's pronation. So when I get a client, I'll always do that first. And what you'll find is clients have different amounts of inversion, eversion at the heel. And so some will move a lot and some won't move as much. So there's always all these variants that really chuck a spanner in the works when you hit each other's feet and all your feet maybe move similarly at the heel. And then you get a client who moves even more and you're like, oh my God, what's going on here? So just to sort of try not to expect anything, just do the movement in the way we do. So full inversion, full eversion. I will always do a few of those first anyway. Then I'm going to go to eversion. I want to feel pronation first because that's the one where I should feel some twist at the forefoot. I take the scoop of my hand and I place 2 fingers over, and I really want to get the hand snug. So don't do it with your fingertips and don't do it with your hand. So we standardise how it's done. So 2 fingers over the top, and you're not quite on the joint, you're literally just below it, so that then when you do the twist, you can actually move those joints. That's what we're trying to achieve, is feeling the movement at those joints. So we lock the heel into eversion and then twist. And so you can see I've had to lock this elbow out here, and then the other one, I'm really trying to feel how much of a twist I can get, a pronatory twist. Then I do a comparison when I lock the heel into inversion. Does that same movement in the forefoot feel stiffer now? And it doesn't have to be stiff, it just needs to be stiffer to the pronated heel position. Does that help, Hazel, with that one? That one's, of all of the foot tests, I think that's the hardest for us to perform, because if you miss any portion of that locking, twisting, then you can get a result and it makes you think, hang on a minute, it didn't do that last time. So it's quite a precise lock, twist, same twist. Always twist the forefoot in the same degree in pronation and supination, so you get an exact comparison. And if it's stiffer when you're supinated, it's a pass. Does that make sense? Any questions on that one? It's quite hard for me to demo. I don't think the dog is going to give a result. He's fast asleep at my feet down. Is that one okay? You all right with that one?
Yeah, it was good.
Arch height. Now, I'm just going to let you into something here. I'm undecided yet, and I need to take back to the master trainers a challenge I'm having in my head about when we mark the feet. Purely because we're marking skin, and the way I've taught you, which is how you should do it for now anyway, is you mark the feet when the client is sitting or lying. And then they stand up and we look at those markers, and I want to just challenge that a little bit. So I'm happy to hear your opinions, or if you want to play with that and give me a feedback, that would be amazing. But I am going to take this one back to the master trainers and just kind of challenge it a little bit, because I don't know whether, I mean, I have been palpating. I mark the client when they're lying or sitting, and then when they stand, I feel where I've put that marker on the navicular particularly. Yeah, Anna.
Yes, to be honest, I had this experience. I done this by mistake, that I've done on the standing person, and then I realized that I did wrong, but that changed my results.
Right, okay. This is
has changed. I had different angle and has changed my results. And then that was actually kind of like confused me. But then I went, okay, it doesn't matter. I will do again when she is lying or sitting. But I've done that by mistake. I don't know why, but I had her standing.
When I've been conscious of this dilemma in my own head, I've done the marker while lying or sitting, got them standing, felt it, and I have found my marker's always been about right. But I'm questioning whether we should mark them when they're standing, and I'm not sure we should. I'm not sure that's the right thing, but I'm just explaining to you the way we're quite transparent. You know, we try and challenge everything. So it's good to hear your view on that, Anna. But the idea that when they stand, the navicular marker you put on the skin may or may not, I don't know, this is my question to you guys, represent the peak of the navicular when they're standing. So what I'm asking you is, when you practice it, when you can, I'd be interested in your thoughts on that. However, until I change it, for now, when your client is lying or sitting, we put a single cross or point on the peak of the navicular, on the pivot point of the hallux, So technically it's going to be in there, is that point. The most lateral, I'm on the right, yeah. So check's on the right side of the foot. The most lateral point of the, sorry, it's medial of the foot, but the most lateral point of the hallux and the pivot point, rather than the top or the bottom is what I mean. And then I think one of the biggest confusing points is when you've done your ledge on your malleolus, it's technically it's the front corner. But I'm saying that knowing that a lot of malleolus don't have a corner. If there was a corner, where the corner goes. So if they have a scoop of a malleolus, I always imagine at least a centimetre line, imaginary line, in the middle base of the malleolus. And if you use that as a guide and then use that front point of that centimetre line, that's how I would measure that point in terms of looking at the angle. Yeah. Naviculars are notoriously quite challenging, as you may well have found out from the few feet you may have felt. And you can get double naviculars, you can have a navicular that's not a circle, it's kind of a ledge. It's whatever you feel you can deal with. And I think trying to not beat yourself up if the answer that you've come to is, I have no idea. I still write that sometimes on clients' documents. I've no idea, but I think based on all the foot tests, they're probably a supinator. Rather than, oh, I can't do the arch height test, I don't know, because they've got a ledge, and try not to get too, you know, down in the trenches when this is the wondering of So then when they stand, we're looking at the relationship between the 3 points. Now, there's this tendency to want to get a pen and you're trying to visualize, but if you just look at the relationship between the 3 points, if they're close to a straight line, it's a high arch. If there's a big angle, as in a drop, it's a low arch. If it's somewhere in the middle, it's a mid arch. If it's kind of mid to high, it's a mid-high arch. If it's kind of mid to low, it's a mid-low. It's not, it's only when I think you get a really extreme foot presentation, it becomes more important if they're also symptomatic. If not symptomatic, and if you're not sure, write what you think. If they're symptomatic, then we may need to pull in our foot friends. Does that help on that one? Any questions on arch height?
No.
Just make sure, the biggest things on a lot of these is just make sure that when you're looking at the feet down here, that they're not kind of hanging over, seeing what's going on, or that they haven't turned the foot out a bit for you to see. You know, just make sure they take a couple of steps, just take a glance, have a little look. Your gut will tell you the answer. It's when you start to question yourself and you start to look at, you're trying to think, oh, how many degrees is that angle? Don't worry about it. Go with your gut. Does it look low? Does it look high? That's probably right. Yeah. The alignment test, most people are usually okay with this one. It's just a palpation of the two talus heads. And again, it depends on how a client presents. Some people are really bony, some aren't. This one's usually okay, but I have had clients where I've got no idea. And really, I encourage you to just encourage them to really go to the extremes of the rock and rolling. Because when they do that to extreme, something is going to push into your finger and thumb pads. And whatever that is, go with that. Take them to the point where you think they're somewhere in the middle. Take your hand away, get them to relax and see if they drop, roll out to get your result. Do you want me to go through that one, or are you okay with the pronation, neutral and supination on that? You happy with that one?
I'm okay with that one, actually. It's it's kind of an easy one to conduct, because you see after you find the middle bit, the middle section, when they're relaxed, whether they move or not, and there should be a minimum movement, but if it's too much, then you know they're pronating. So I'm okay with that one. I don't know about other peeps.
Yeah, it is one. Thanks, Omar. I think it is one that most people feel like, that this is one of the ones people are like, oh, I think I've got that one. Yeah. No. No, not at all, Chris. As long as you're showing that we can see you understand how to perform it, and then what you write on your links man or your screening form, you know, I would have a look, and I might, you know, we might have a check-in. It's not that detailed. We're not going to go in and go, well, actually, I think it's, you've said low, and I think it's mid to low. You know, we wouldn't. We might just say, why did you think it was low? Because there's some room for ambiguity and personal interpretation. And so I think, so no, no, you don't need to. What you do on your exam and what we want to see in your exam is exactly what you would do with a client. Don't dress it up, don't act, don't pretend, don't behave, just do exactly what you do with a client. The assessors, it's probably going to be me anyway, I think, unless I can get somebody ready by then. The assessors are actually really skilled at seeing everything. So even though you might think, oh, they might not see me do that, and then, you know, we're actually very skilled at seeing a lot of things that people think we don't see. And I don't mean that in a sneaky way. I mean in a way, because we've been doing it a while. We know what to look for. We know when you're getting to a point within the system where we think, actually, I'm going to have to watch that. Like it might be like Downing sign, for example, because we're obviously writing notes and looking at the same time. I time the point when I'm going to write notes, when I know you're doing something that's quite easy and I've seen you do it and you're quite confident with that. But when it's Downing sign, we're watching like a hawk to check that you do the right order, is an example. And generally, the practical is just, do you know what you're doing? Are you safe? Rather than a precision test. Biomechanics is not a precision test in the way we're using it. This is about, do you understand the test and how to apply it and what it means? That's all it is. So the supination resistance test and the JAX test, remember there's a slightly different sort of focus for them is, does the foot have the capacity for supination? These are usually, people are usually okay with these, but if you remember, we grade these on effort. So 0 or 1 to 5. 0 or 1 is very loose or very easy to pull into supination. 5 is when no movement is happening at all. So supination resistance, you would be side on to the client, 2 fingers only, under the arch of the foot, and then you hang back, arms straight, and you do a mini squat back. So we don't want to be pulling with the arm. And the reason for that is to standardize the effort, the amount of newtons of pressure that are going into the foot, or to try as best as we can with with manual testing. And then you score subjectively how easy or hard it feels to do that. We're not measuring the height of the supination. We're measuring how hard or easy it is to go into an arch. Some people's arches will be bigger, some are smaller. It's more about the amount of effort than the size of the arch. Yeah. Same with the JAX test. So where we kneel down in front and we put the thumbs on both feet under the kind of where we can extend the toe. We don't want to be under that first knuckle where it might just extend the end of the toe. We want to get under so we can get that second knuckle extended. And we want to push. And I don't know if you've felt this yet or not, but it's not uncommon that when you push on a toe, you get a stiff bit and then it goes. And you kind of push and then it goes. Make sure you get to the point where you feel like you literally can't go any further. Remember, their body weight goes through that joint and their whole body weight through that single joint in one occasion every time they take a step. 3 or 4 times or 7 times or whatever it is when you're running. So don't be afraid unless they have a deformation, i.e. a bunion, and then you need to follow their angle, their direction. So my right foot is a good example. So just make sure you're moving cautiously in terms of the way you extend a toe if the foot is deformed. So I would always say to that individual, let me know if it's uncomfortable. I would push gently, and then as I'm doing that, I might then start to go a bit harder, get a sense of where the toe wants to go, and push in that direction rather than trying to line it up. Because if you line up my right toe and push it, that'll hurt like hell, because it's no longer structurally designed to go in that direction, even though that is the aesthetically right line. It's adapted. So, and then you would score those. If there's no movement in the arch at all, it's a 5. If the movement is 0, nothing, no arch, nothing moves, the toe may lift, but the arch does not change, 5. If there's a little change, but it's really heavy, oh yeah, you know, you can move it, but it's super heavy, 4. If when you pull or push the toe, pull the arch or push the toe, the foot just kind of literally kind of flaps over, that's a 0 or a 1. So it wants to be somewhere in the middle. Again, bit subjective, but again, when you felt a few feet and you've scored a few, around about the 2 to 3 mark, and then we're good. We want the ability to supinate, but we don't want that ankle kind of rolling over too easily, because again, that can hold risk. Does that help? Yeah. But they're very hands-on. Feet we're least confident with anyway. It's harder to relate feet to muscles just because of the nature of the way the muscles move you into pronation and supination. I don't know if you've looked at the muscles in the lower limb, but they can be quite complex. And one muscle does pronation and supination components, so it becomes quite complicated in the way we've talked about previously. But it is literally just about looking at and playing with as many feet as you can when you can. While you're limited, you're limited. I haven't felt feet for a while myself. So any questions, any more questions on feet or foot tests? Okay. So we've done the catch-up, we've done the Q&A. Anything more practical that you want to go through, have a look at? Okay, so really what we're looking at is what's next. And so ultimately we're working towards, when we do get a date for the practical practice session, what I would suggest is, how much you've practiced or not, is to, even if it is your husband, Omar, for example, get a flow, find a flow, design a system. So Anna's got her little book of system. You know, Omar might have his list of which exercise goes with which test. And actually in the candidate achievement record, I don't know if I can put it in here. Let me see if I can. Yeah, there you go. So I've just put into the chat box the candidate achievement record. So if you pull that off, if you haven't had a look at that already, what I will do now, and again, this is not compulsory. In fact, I'll screen share with you how I might do a consultation to there, and can you see it?
Yeah. Right,
okay. So this first bit, the client management bit, that is purely Biomechanics coach. So you would need to add into that PARQ, your COVID-19 questionnaire, you know, all your setup. So that's not a full consultation. That is just a sample of an initial, as a biomechanics coach, what I do, what I don't do. It's just to give you a bit of a flavour. So make sure you expand on that. This slide, again, is about taking information. What do they do for a job, outside activities, age, obviously male, female, any medications. And this one I use personally for their reason for visit. So, and I'll come back to that in a moment. So they've come because their back is sore. So I say, right, fill your boots, tell me all about it. Give them some airtime so that they feel heard, which is really powerful in terms of building a rapport, letting them feel valued. This is often a part of where clients will say, biomechanics coaches, you know, nobody's ever listened to me like that or explained it to me in that way or whatever it is. So let them have some airtime. That gives you an opportunity to listen to their vocabulary. Now, this is kind of almost like a marketing technique. You may have heard this, where if you allow them to speak and kind of just ask questions and let them expand, they're going to tell you how to sell it back at the end. So that reason for visit, even though I might change the SMART goal a little bit to help fit with what I can help them with, is really important. It's going to give me the language I use when I'm selling the exercise program back. So that's their airtime. Tell me all about it, Omar. You've got a sore back. How's it affecting you? Describe it, you know, and I would ask questions and let you expand. The next slide, where you've got the body, is where they might pinpoint certain areas. So at this point, we're going against our remit, because we're allowing them to tell us about their pain and their injuries and problems, to the point of, well, if they've got all these problems, are they really our remit? Let them expand, let them, you know, fill the boots. I usually give them a pen at this point and say, you draw on this body like it's you. I want you to colour it in if it's an area that feels fuzzy or tingly. If it's a very specific point, do a cross. That's the back, that's the front, that's your side, that's your pelvis and shoulder blades, and really let them have, again, I'm passing the control over. These are very subtle but very powerful empowerment tools. Then the bottom bit about pain and discomfort. Again, I want them to know I'm listening. Score it. How does it feel? Out of 0 to 10, 0, no pain, 10 having your arms ripped out. Let them explain. I would write everything in their language, tingly, numb, achy, sharp. I might even write notes in there about the way they said it. And then we move into a SMART goal. So this is where I start to talk to them about, are you familiar with SMART goals? I can't promise you pain relief. I know what you've come to me for in your reason for visit and on your body is because you've got a sore back. But we need to create a goal based on my remit. So, and I explain what the SMART goal process is if they don't know it. By the way, in your case studies, you need to write SMART goals. Just by the way, I'm assuming you all know what a SMART goal is. Specific, measurable, achievable, realistic, time bound. I would then still ask them questions, say, how can we make getting rid of your back pain, Omar, specific and measurable? Because pain is very subjective, isn't it? And we'd have this whole conversation. So is there a movement or a task that you do in your daily routine that you struggle to do because of your back pain? Yes, I struggle to get on the floor and play with my nephew or whatever it is. Right, okay, so what does that look like? And I might visually get them to show me what it looks like when you're getting on the floor. So I would ask Omar to get up and down off the floor. I'd have a video of that. And that is my benchmark. That is my SMART goal. How can I help him do that successfully without discomfort, and et cetera, et cetera. So this one might, Omar, help you out. This is where I realized previously, I made this particular page because I would send them away with exercise. They came back and I was like, oh, I can't even remember what exercises I gave them some time ago. So in here, you've got two boxes. One is general overall evaluation. So that might include mood, you know, behavior, the confidence, things like that. And then the exercise prescription is very prescriptive. That's very much about the 4 sign twice a day, 4 times a day, 8 times a day, some adduction work twice in the next 5 days. So I'd be very, very specific in there about what I've asked them to do. Because when they come back and you say, what did I give you? And they go, oh, you gave me that 4 sign to do once a day. And, you know, it's like, actually, no, I didn't. But this all goes along with the exercise sheets. And then this would allow me to explain to them about, this is why, Omar, I'm not going to talk about pain relief as the goal, because your pain may subside in the first layer. Sorry, it's on its side. In fact, can I tilt it? There we go. So while your pain may subside in this first layer, we haven't finished getting you fit for getting on the floor with your nephew. We've actually got some more processes to go through. So I would spend quite a bit of time talking about that. Chris, in your environment, definitely. So with the dog agility guys, yeah, okay, you want to win the dog agility next October or whatever it is, but to get you there, we need to get you moving well. We then need to get you stable on 1 foot, and then we need to get you turning really quickly so that you can then guide the dog and so on. So you can really make this very, very specific. Then I'll be talking to them about, so this is what I'm going to take you through. This is you on the right, and this is going to be the tests that we do. I can explain this all at the end, but some will be lying down, some sitting, some standing. I'm watching their face as I say all of this to see if I might say, I'm going to ask you to take your top off. Is that all right, Omar? And if their face is like, well, I've got to take the top off. I said, no, we don't need to do that. It just makes it easier for me, but I don't have to, that's fine. So that then I'm actually reading their response to everything I'm saying. This page is just to, if you want a detailed page, and again, this is about remembering the core progressions. So if you did want to test somebody and see how far they got, this is a little bit like Anna was talking about, is literally you've got each one laid out. So you might just take them through. That is actually on here. You've got the prone, hollow bit where you could amend that to where they get to, or you could literally take them through step by step. Same with the knee and foot. This is just for when we were learning it on the course, so you don't need to separate it. But just if it helps you through the process of the practical assessment or with a new client, you want to, all right, I want to focus on feet. What am I doing in the feet? It holds more detail than this one. So if it's helping, but you don't need to, as I said. This is obviously just purely a slide to have in your head when you get in the thick of it and you're going, oh my God, what am I doing? I've got no idea. I'm just trying to improve function and movement. It's actually really easy. I'm in the complex bit in the middle. Come on, Anna, just measure, is it symmetrical? You know, take yourself through it. The pain side of things, remember, don't chase the pain. Try not to prescribe to pain. Forget the pain, be kind and be conscious, but just move that aside on all your decision making, other than if it hurts, don't exercise it. If they have a sore back, do not give them wall glides. If they have a sore back, do not give them wall glides. I say that twice for a strong reason in terms of teaching in the past. Keep coming back to the so what, and this is for all of you guys that have mentioned, so Linda, Chris, about the feet. Don't worry about it. The only thing you're going to do is exactly what Chris is doing already. You're giving them a few supination exercises, just get that lower limb moving a little bit, getting some strength work in there. There is no contraindication to that if you know, as long as the feet are fine, obviously, and you're just sort of encouraging supination there, not a problem at all. And again, I talk about on the assumption side of things, when you're getting hold of people, when you're getting hold of people more, try not to feel surprised when, I mean, you do sometimes, you get hold of an ankle and you're like, oh my God, I've never felt somebody with no tailless heads in their ankles, you know. Never assume anything, just get hold of them and trust your judgment. We are all very different. So that's kind of how, if you like, to use that sort of the candidate achievement record, and hopefully that just helps a little bit in terms of why each of those pages are in there. You don't have to use them all. You can tweak them, make your own up. There's a lot of pages in there. They're more about giving you ideas of resources that might be more useful to you. Yes, in the 2,000 words, Chris, so your SMART goals are in criteria, I think it's criteria 4 or something.
So actually in the case review for each, because like there's 4 clients, obviously, part of the review, you have to actually say, like I've done the SMART goals for them, I just haven't actually put them in the review part, but you actually want to hear the SMART goals for all 4.
Yeah, let me show you. So your practical exam, sorry, Chris, I'll come on to yours in just a second, is this one. So your 2 key components in the practical is demonstrate correct screening protocol. Did you put your thumbs on the PSIS? Did you rotate in first, etc.? And then are you safe? As long as you do those 2 and you look like you know what you're doing, you're good. Yeah. Same with the exercise prescription. Then coming down to the point Chris was making. So, number 1, age level sport, specific movement goal. It should be SMART, should be in there somewhere. I may need to, maybe this is not the latest. In specific movement goal, it should be SMART goal, that should. So your criteria 1. So for example, Chris, you've got your 4 clients, so Barry, Jane, Bob and Sue. So Barry, 54, dog agility, a bit of back pain, SMART goal, dog agility competition, October the 13th, wants to reduce his time by 0.3 of a second by October.
Yeah, like I said, I've got all the SMART goals. I just didn't put them in the actual thing, so I'll just make sure to put them in.
Yeah, always have a SMART goal so that we can see that you are using them. One of the common things that I've seen in case studies is this client came to me with a niggly back, but that's not your remit. That's not what you're trying to achieve. You've got to. And I'm trying to highlight the importance of us understanding our remit, which is why I want to talk to you about this safety net. So yeah, if you can add those in, Chris, that would be fantastic. Just literally, just write in the SMART goal. You've got it already, then that's fine.
One more question just before I forget, if that's okay. With regards to the case studies and the grid forms, when we give them in, is it kind of one chance, and if you don't pass them, that's it, or?
No, nobody fails. People refer, but nobody fails.
Yeah, so if like it's a refer, you'll give them back and you'll say, look, you need to do X, Y, and Z, and then it's just.
Yeah, we just ask you more questions. So you would email it in. You have to allow up to 4 to 6 weeks for your feedback.
Yeah.
You would have a glance and make sure everything's in there, and then one of the tutors will go through it, and they'll basically cross-reference to the criteria. And as long as you've hit all the criteria, you get a pass, you get a certificate. If there's a part of the criteria we're thinking it hasn't really, like the SMART goals, we would send an email back saying, can you give us the SMART goals? And you send them through, say, yeah, fine, brilliant, pass you then. If there's a couple of things, we might have a phone call or a Zoom call and just find out if we need to expand on something or send you a resource. But yeah, you just get an email back with further questions.
Okay, thank you.
Case studies, 12 weeks after your practical. So I've just put in the clinical questionnaire, which is the safety net. What I'd like you to do is, can you grab that? Can you click on the Wufoo link at the bottom? And you should get a biomechanics coach clinical screening form come up. Are you looking at that? Just nod or stick your thumb up. Chris has got it. Yeah, brilliant. Right, okay. This is we're presenting into SimSpa. We've linked with a software platform that has a database of both clinicians and clients. And what we're trying to do is protect everyone in a system that allows us as personal trainers to put symptomatic clients through this first. What that then does is, if you look at the original document I sent you, it's got A, B, C, D, E, so parts A through to F. So A is diagnosed conditions, so if they've had a diagnosis. B is medication. C, broad questions about general health. If they answer yes to anything in C, it's A and E. D, specific questions about general health. E, musculoskeletal health. If they answer yes, it's a referral to a clinician. So when you go through that, and if you want, you can fill it out yourselves and send it in. It's just me who gets it. And then what I do is I refer on either to, or I recommend rather. So if you get a C or a, what is it, C and E, I think, isn't it? Let me just have a look. C is A and E, E is a clinician, yeah? So what I mean by that is, if you get, when you're putting a client through a consultation, every single client I get now has to fill this out first. If it all comes back and it's clear, fine, I crack on, and I know I'm working within my remit. If you have a client, like I had one this week who, no red flags, nothing, acute pain, which is obviously a red flag, but outside of that, no red flags. I've put him straight into this system. He's come straight back with guidance written about what I can and can't do from a physiotherapist. And that cost 50 quid for that consultation. The lady who I got back, who had the plate dropped on her, she went through it. She's had nerve blocks, she's had disc herniation, she's got all sorts of stuff going on, stuff that would make you go, oh my God, I can't work with her. Sent straight back. This is what you can do, this is what you can't do. I can now work with her. I've got it written under the guidance of a physiotherapist, and I now know I can work with her, and I'm working with her confidently rather than sending her away or working with her and thinking, you know what, I'm not sure if I should be working with. Do you know what I mean? I strongly recommend, while you can, even if you just do it as a practice, is start putting your clients through that, because it's going to become eventually a paid for system. And it's so rapid, within 24, 48 hours, you could get a letter from a clinician saying, do this, don't do this. Full report. So I obviously can't give you the details because this is confidential, but the clinician will send you purpose of the session, flags, what the flags were from that form, the medical background, any medication, any training they're doing, and then after the consultation, a list of the symptoms, the diagnosis and pathomechanics, the plan, and they'll give a structured plan. So I've got phase 1, 2, and 3 that I can work with this lady. Therapy interventions, things like using a ball in the glutes until such time, dosage of exercises, general exercise advice, and also, if this happens, do this. If this happens, do this, follow this guidance, or send them back. So the value of that for us as practitioners, and then follow-up, when to do the follow-up. So I've now got the client who sounds really high risk, beyond my remit, but she's been sent straight back within 24 hours, less than 24 hours, with loads of guidance on exactly what exercises to do and not do, not exactly, but like guidance on the Biomechanics coach model. And so with your Biomechanics coach training, the physio can then guide you specifically around I Move Freely. So I strongly recommend you have a look. Are we just looking at the ABC or the actual form? Have you got the form? I was looking at both, Gordon. So I was using the ABC in reference to the form.
So you click on the link.
Yeah.
Yeah. I had to download it, and on that, when it comes up, it's a PDF. There's a link at the bottom. Click on the link, and it comes up with an error.
So you should have a biomechanics coach clinical screening form.
No, I'll tell you what I get.
What we've all got. Is what you should get, and then it goes through. This can all be done online. I can get you a PDF of it, but it won't function, Gordon. So you need to be able to get on.
Yeah, that link doesn't work for me.
Bottom right, the Wufoo link.
The Wufoo link at the bottom, across the bottom of the PDF.
It must be something to do with your settings then, because I think we've all got it. So it must be something on your laptop, I'm afraid. Maybe try.
Comes up and says, "Whoops, that was unexpected. This contest doesn't exist."
Yeah, I've got the same. So when I went into the actual link, because I got Adobe Pro, where you can look into the link, it's broken up into two. So after forms, dash forward, you have the Z1 NDP and all that. I copied and pasted that on a browser.
I've got forms 220, access 20, the assessment form.
Yep. So I deleted the TO, the 2, and I added the form name, which is Z1 NDP, and the form came up.
Z1 NDP.
PC5 N00.
NDP. Oh, what's that? Just copy that and paste it on the chat, and then I can just pick it up from there.
Yep, sure. I'll do it now.
Thanks, Omar.
Yeah.
And obviously, the more that we use this, I've used it all over lockdown. I've had loads of clients, as I say, and I know Anna was looking. I think Anna, you've had a couple of your guys go through it, haven't you? So I think it just is a confidence builder. We're trying to fill a gap and increase your confidence about working with problem clients, but keep you in remit. Because I think a lot of us in the past have maybe stepped beyond remit, otherwise we wouldn't have any clients. And that's not the right reason to just ignore things that are not out. We really should be taking advantage of these clinicians who, the system we're going to evolve is that we have a choice of clinicians, whether it be local or some of these online, obviously, as well. So please use it. It's free. We're trialing it and playing with it at the moment just to see if there's any tweaks that need to be made. While we get something built, we're presenting to SIMSPA next week, or next month rather. We've presented once, they loved it, and now that we've developed it even further, we're going to present in how it now looks. What I'll be trying to do is obviously look after the biomechanics coaches, the IBA members, and if I can, leave it as part of the membership. And then when we roll it out, it becomes something else for people who are not biomechanics coaches. So any feedback you've got would be really helpful. Do you think that would be a useful resource?
Yeah.
Yeah, have a good look at it, have a route round it. If any of you decide to fill it out yourself or a client, it's me who will get it at the moment. I will always get it. Your client will put your email in, so you would get a copy. It is automatically designed to always send a copy to me, which is within the GDPR tick boxes within it, that your client should be able to see. Obviously, I won't share anything, but I would come back to you and say, do you want help with this? And just find out if the system is working in its simplest form. So please do play with it, have a go with it. Let us know if you think it's helpful or if there's any way we can improve on it. But it has been designed by clinicians. And the point of it is to educate clinicians on how to help us. It's not just for us to get cleared by a clinician. We need the information from the clinician to guide us on movement-based practice. So anywhere where you think we can improve on it, then do let us know. Thanks for that, Omar. Quick question. Can you remind me who is level 4? Omar, Linda, Hazel, Anna? Chris, you are as well, yeah. Right, okay.
You're talking in anything specifically, Rachel? Just
sorry, who wants to gain the level 4 low back pain?
oh, sorry, not me. I thought you were asking if we were already level 4. Sorry.
Hazel, have you all got your GP referral?
Yep.
Yes. No, right, okay.
No.
So you got GP. Because I'm speaking to an organisation on Friday about developing a relationship to get people through that as quickly, swiftly and easily as possible. Yeah, keep going with that. You've got the learner achievement record, haven't you? Yeah, okay, brilliant. So it is an extra set of exams on the end, but at the moment it's not. Hopefully you'll see it's not the priority at the moment. We're just trying to get through this bit, get the practical stuff, but rest assured, there's no cost to get you through that. It will just be, we'll get you on it as and when we can, make it sort of more realistic. So I think that's everything I've got on here on my list. The what's next is really, we're waiting on Boris now. I know as much as you, I think, probably. I will let you know if I make a decision on any dates. You'll obviously be the first people to know. I'm doing lives every Wednesday. You're very welcome to join those. They're completely free. I'm speaking to all the other diplomas this week and next week. You guys are the first ones I've spoken to, but actually you guys are the ones that are most advanced. All the others are either missing a module or they've only done one module. So you guys are kind of the most ahead of everybody from last year. So you're kind of good to go in my eyes in terms of where you're at. It is purely practice, and that's just sadly something we're all limited on at the moment. Any questions, guys? Anything else right now?
So, yeah, I just want to talk to Anna, really. So, Anna, your process that you put together, I just wondered if you have a PDF version which you can share with us, because I'd like to have a look at it.
To be honest, I don't have a PDF version, because what I've done, literally, I took from our biomechanics book, okay?
Yeah.
So I've done each test, okay? And I literally like highlight. So as I was going through my to the process with my clients,
Yeah.
what I was doing, I was highlighting the things. For example, like, do I have to remember that I have to face down?
Okay, yeah.
To remember how to put, so kind of in my own words,
Yeah.
I can literally look and I can, for example, what I have to look for. For example, like when I do the test in the pelvis, that my thumb have to move. So kind of this very important stuff. But
Okay.
I do this. If I had a PDF, if I will have time to do the PDF, I will forward. But to be honest, that was me kind of like. So I look through the Linkman.
Yeah.
With the feet, and literally this is the order what I use for my book. So I've got my book in my folder.
Yeah.
And my client comes, I put the book next to him, and literally I go through the pages, and whatever I will stuck with, I literally do the notes. Remember about this. Remember that you have to ask them to face down. Remember that you have to go sit up. And that
Okay.
is, I feel that is taking the pressure of me to remember. So I used the manual what Rachel she sent to us.
Yeah.
And I used with the pictures. And I and the describing the notes, but also I highlight everything what I have to remember, what is important for me during the test.
Yeah.
Like the food test or whatever. And then now I'm working on adding to exercise to that. So for example, when I have, for example, when I've got the down sounding test, so for example, I know that is the test, and then I'm adding exercise. And as I'm going along and gaining more experience, I can add more and more exercise and just that decrease the folder. But I found it's taking lots of pressure from me that I don't have to remember if they have to go face down, they have to sit down, sit up, because probably if I have experience like Rachel 20 years, I will need it for my folder. But at the moment, I can't make myself to memorize this. It's too much to take on. So just make easier. So this is what I did. I literally used the manual in the folder and like.
Okay, each page. Just go through it. Yeah.
Yes.
Anna, could you take photos of the order, or could you take photos of it and put it in the group?
Yes, of course. Yeah, no problem. I can actually take the photo. Oh, so what I've done in my folder, I've got the link man.
Yeah.
Okay, and literally how I've done. So everything what is on the coach, and I only move one of the tests from the chair to the coach because there is on the coach, but actually should be on the bed. The one I don't remember which one now, but I know. Oh, I don't remember from one of the groups. But I'm happy for you to actually take the picture, like page by page, how I put in order, and I can send it to you all. And I found this is very helpful because I can just find. And to be honest, I've got like literally the most important information. So at the back, I've got this, and I've got the big link man without the foot.
Yeah.
And there's like, when I'm starting from the first, so it's like, the leg discrepancy, and this is how I'm going through each of them, and this is how it's. So I will take the pictures. Probably will be later tonight because I've got the PT clients and then teach, but will be to you by tomorrow, I promise. Okay?
Yeah, brilliant.
Yeah, and you're welcome to use. And if you've got any question, you can just message me, and I'm happy to help you all, and you can ping my idea, because I was just looking for something to make me easier and don't stress about remembering the order, because that's what Omar said. For me was like, oh my God, what now? When I feel more confident because I look and I feel, and even if I'm stressing inside, my clients can see. Because I know I can refer myself.
I've just put a whole battery of PDFs and changeable formats that other coaches have made, and you can just pull those off, make your own. The last one, Omar, I think helps your query about, was it the last one? Wait a minute, there was one in there that had the exercises. Oh, it didn't put them next to the, I thought it put them next to the tests. But you can do what Anna's done, or literally just using one of those screening forms. It depends on how many notes you need to make. Initially, it might be more like Anna's idea, and then it might be less. You just flip it over and write yourself a couple of notes. Downing sign might be in first, but it depends. And I think everybody needs different sorts of triggers. Everybody's got different challenges. And so it is really about you designing your own flow, screening form, reminders, things like that. So hopefully those that I've sent through, feel free to use them. Obviously remove logos if it's got one of the other coaches' logos on it. But feel free to create your own, definitely brand it yourself. Cool, thanks Anna, thanks Gordon. Anything else, anyone?
Just one thing. I know we are brainstorming now, so and if people need to go, that's fine. But I just thought, adding to what Anna said, and kind of taking what you said, I think it's really important that you guys, like everybody, for us to do our own little flow, because triggers will be different for everybody. I've got on the screen, I don't know if you can see. Oh, I can't share, but I've got on. I'll send you something on the WhatsApp group. So where basically, when I did my screening form, I put little notes on the test I never remember. So for example, if I say subtalar motion, the only reason why now I remembered that it was the one when Rachel was doing it is because I put a note on a linksman saying prone wiggle. That might mean nothing to other coaches, but for me it's like face them down and wiggle the foot. So that's you gotta be a bit savvy. And I think if you have that kind of little reminder on each test, or the test that you find it hard to remember, it's a massive bonus. And it's about us going into each test and actually see which one is easy for us to remember and which one we need some help, and note it down, I think.
Yeah, I've done it to share it now.
Exactly. It's the same. Omar, like for example, I put on the mid-tarsal joint test, like for example, elbow up, elbow down. And it's like, no, and this is exactly, so for some of them, someone can read it, it's like, what she means, but for me, I know, it's this. So this is how I memorize, and I put in like, no, so yeah, I totally like, no, this is what I've got the paper with the test, you know, what is in the manual, but then I've got lots of like my own notes, the way how I put it.
Yeah, thanks for sharing, Omar.
So you see, I put down, for example, prone wiggle, Thomas test on the edge. So I know the client needs to sit on the edge of the bed. So I need to remember to put the knee on the bed, otherwise it's going to fold in half. Just little prompts for myself, because these are the ones that I never really remember just by telling the name. If I said to myself, "Oh, let's do a subscapularis," I was like, "Is that forward? Is that backwards?" I don't remember. So I just kind of try to remind myself and practice. I think practice, but I think this really, I don't know if how big I can make it, but these little tiny notes really helped me when I was doing the practical, just to feel more confident and look more confident. Because if it's not, somebody it's a client that wants to be assessed, and you're like, you want to look professional, you want to kind of feel like they're looking at you thinking, oh, this guy knows what he's doing. And that really helped me anyway. If anybody wants to use that, please do.
Yeah, one note to make though, Omar, thank you so much for sharing that, is
How do I unshare? I don't know.
You shouldn't use P&N on your pelvis, spine and shoulder tests. So only use a plus or a minus, because if you use P&N, it means something different in the feet. So only use PN and S in feet, and in the rest of the body, use plus and minus. Because if you use P and N for positive and negative, when you get to feet, it's different. So if you always have the same standard, so use plus and minus, and then P and N and S for feet. I really appreciate you sharing that, Omar. Thank you so much. Cool. If there's anything else you would like me to put on, if you want another Zoom, if you think this would be helpful, there's something I'm missing, if you need another resource, please let me know. I've just started adding more mini workshops to the website. Please don't pay for them. I will, if you want them, let me know and I'll send them through. Just to help through lockdown. But if there's something I'm missing, I've done behavior change, there's the anatomy blogs, I'm doing a squat seminar one. They're more for tasters, for people who haven't experienced our training. But if you want to have them, let me know and I'll send them through.
Rachel, I don't know if anyone, but for example, how Omar said with the exercise for each test, would be able to, like, if we can have a Zoom call, when, for example, we just go through each test, for example, but just talking about it, or for example, if like no, and then for example, just throw it our like ideas for the exercise. For example, when is what? I don't know if that is possible, and how everybody feels about this.
When you say exercise,
Okay.
do you mean I move freely, or do you mean the strength stuff?
I mean both.
Yeah,
both.
So like exercise flows.
Yes. So for example, when we have, for example, client positive, for example, with our, I don't know, on the Thomas test, and for example, what we do, so we go through the process. So we have to give them release first, then we do antagonist, then we do agonist. So this kind of thing. So I think so is, for example, for me, will help me to put some order in my head and visual what I do, and it makes me feel more confident.
Is it the order or exercise ideas that you want?
Exercise ideas, yes.
Sounds good. What I might do is I'm wondering if I can put you with another group and get more people, or if you're more comfortable with a group. It's up to you. Because I'm thinking that you don't mind, right? Okay.
No.
I'm not sure if it's appropriate to put you in another group. I've got about 6 groups. Let me just have a look. Nottingham, you could do it with. That would be good, because they're just missing the low back section, but they're in the same place as you, other than they haven't done that bit. They've not yet. They've not yet. Yeah, so I might just put you with Nottingham for that. They may benefit from that as well. Is what I'm thinking. Is if we do that as a group Zoom, and we have a couple of hours, and what we'll do is we'll literally go through. So if you prescribe foresight, what would you do as an antagonist move?
Yes.
We can put our hands up and give an example of a flow.
Yes.
You can see that, and you can have access to the video afterwards too, so you don't need to write it all down. I can give you access to it. Yeah, good idea. Good shout, Anna.
Yeah, good.
For that as well. I'm speaking to them on Friday, so I'm doing this session with them on Friday, and it'll probably be February now, because I'm like up to my eyeballs with stuff over the next couple of weeks. So if we do that sort of mid-February, something like that, maybe 2 or 3 hours, do you think?
Yes.
Do exercise, bring your ideas for exercise flows. I think there's a lot will like that, Anna. I think that'll be a good one.
That's good.
Good shout.
Also, as well, Rachel, can you have a look into if there's any problem on the Biomechanics site for logging in, or if it's something to do with my login details or something? Just because you said about the things that we can look at.
Oh, they won't be on there. They're just on the website. I'm selling.
Oh, okay.
What I'm saying is I'm selling new stuff. Don't pay for it.
Okay. Yeah.
I'll send it to you, but have a look. If you like it, I'll send it you. They're like, they're normally 27. I'm selling them at £7 or something. But don't pay for them, is what I'm saying. Like behaviour change, pelvis anatomy, spine anatomy. Yeah, don't pay for them, is what I'm saying. For you and your IBA, we're doing some updates at the minute, so I don't know if that's interrupted something. I'm still looking at it, so if you bear with me, you should all still have access till March, so you've still got a couple of months yet. But let me know if I don't know why others are getting through, so I'm not sure why yours is different. Just check when you go in, maybe try forgotten password and just see if that just kicks it. But if not, I'm onto it with the web guys at the minute.
Yeah, it lets me log in. I can get into it, and then I can click on all the different options and everything. But as soon as I try to access, say, downloads or something, it says forbidden request. You know, you're not allowed on it.
Can you do me a favour?
Yeah.
Can you screenshot the error?
Yeah, I sent it to you, I think, last time. It should be in the messenger.
Sorry, I didn't.
It probably would have looked like it was just a white page, but it's just in the very top left-hand corner.
Yeah. So at what point did that, if you can let me know, can you send me the URL of that page?
Yeah. So it's literally, I can go for all the different options. I can click on like my account, downloads, all the other bits and pieces. But as soon as I try to access what's inside that file, it won't let me say anything.
So it's the downloads.
So downloads, I think it was all of the other stuff. It just wasn't showing up with anything. I'll have another look after we finish this session and just
so find me the
check
terminology. You know the box on the left that's got the red in. You got memberships, download, subscriptions. Let me know which box exactly, and if you grab the URL, send me the URL where the fault is showing. Then that's what the web guys will ask me for.
Okay, yeah, no problem.
And then so set up diploma, exercise flow session. February. If I can do it sooner, I will do. But I think we all need a bit of time. We're all kind of busy with stuff going on. Okay, guys, if there's nothing else, I'll bring it to a close. And thanks for being here. Thanks for your input. It's always good to see your faces. Keep doing what you're doing, guys. Keep, whatever you can. We're helping people move better with less pain. Whatever we can do to support you, just give us a shout, and I will see you for an exercise flow session.
Brilliant. Thanks, then.
Thank you.
Take care, everyone. Well done.
Bye.
Thank you.
Thank you. Thank you very much.
Bye. Nice